I'm Dr. Jason Itri at Studio Aesthetics, and I want to share my personal experience with hormone replacement. I was in my mid to late 30s and going through a slideshow with my family, because that's what we did when we were kids, so I put a slideshow together of our family. And I remember seeing a picture of myself in the kiddie pool with one of our kids and wondering who that guy was in the picture. It was a guy who had no muscle, who had a big gut, and was balding and looked like he was in his 50s. And I think the term people use for that now is the dad bod. And it took a second for me to realize that that was me. And I couldn't believe it, because in college and med school, I worked out a lot. I had some good friends and we were in the gym all the time. And somehow all those gains have gone away through the process of internship and residency. And so I realized I needed to do something different. And that's when I got back into fitness and dieting. I had a lot of the knowledge before, so I just made lifestyle changes and was able to get pretty well cut, got down to about 140, 150 pounds, 5'8". And then I started working out a lot more. We got some weight machines in the garage, and my wife Brandy was a fitness competitor, so it was easy to get into that routine of workout and dieting. And what I realized is that over several years of working out and progressively getting more intense and spending more time in the gym and working harder, I was making almost no gains in terms of muscle gain and very little gains in terms of strength. And that was nothing like what it was for me when I was in college and med school. So I remember I was very frustrated. I thought maybe I was overtraining, maybe there's something wrong with what I was doing. I had gone through a bunch of different workout routines, a bunch of different diets. I was doing dirty bulking, getting fat again. And one day I realized that I had no libido. It had been 2 or 3 months before I had any interest in doing anything. And that was my aha moment to realize that I was low T. And that was probably in my early 40s. And it took a few years to figure out that I needed a better solution. And that's when we found a local provider who did bioidentical hormone replacement pellets. And so both Brandy and I started doing that. And that was a game changer for us, because that's a procedure you do once. And as long as you get the dosages right, you don't have to do anything for 5 or 6 months. And that got me into the physiologic levels where I wanted to be, where my symptoms were relieved and I didn't have any of the irritability or frustration or anger or mood swings that come with a high testosterone level, or any of the potential complications of high testosterone levels. So over a span of 10 years, I spent a lot of time learning how to do this right and what my body needed and what benefited me most to get to the point where I'm at now. Back up to about 180 pounds, 15% body fat, and that's because of diet, exercise, and bioidentical hormone replacement therapy. So I know that there's a lot of people out there with a similar story. The facts are that men in their 40s, about half of them have half as much testosterone as they had in their 20s. And a lot of them are symptomatic low T. And what I'm here to tell you is that there are some solutions to that problem. There are some great solutions. And don't think about it like you're taking a medication. Think about it like you're restoring your normal levels back to the physiologic level, back to what you were in your 20s. So if you're having any of these symptoms, and you're thinking about low T and wondering if you are, let me tell you that there's a lot of options for you to help you with that problem, and a lot of ones that can make a huge difference in your life. We have a lot of patients who come in for BHRT, and every one of them is happy with the experience, and every one of them comes back to do it again, because it's like feeling like you're in your 20s and 30s again. If you're looking for a provider, I think that there's a few things to think about. You want to go to someone who has experience in this area, who knows how to monitor your hormone levels and how to do supplementation. It's really important to understand yourself and the provider that what we're treating are the symptoms. We're not treating the number. Our decisions on what to supplement and how much should not be based on your testosterone level. We work within a certain parameter for testosterone levels, but really we're treating your symptoms. And that's why it's so important that you have to find a provider who really listens to you and understands what your symptoms are. You want to make sure they have experience in this area and doing a lot of these procedures. And the last thing I would suggest is there's a lot of providers out there who provide services and treatments that they don't themselves use. It makes a difference when you go to a provider who does the service on themselves, who does the treatment themselves, because they understand firsthand what you're going through. So, wherever you look for, if you think you have the symptoms, there's a lot of information online to look at. It's something we at Studio R do full time. We're happy to help you. We can get your labs done. We can talk about your symptoms, and we can find a good treatment plan for you to get you back on your feet and make you feel like you're younger.